It's not just families in Uvalde that are feeling this anxiety and fear. We're all feeling this, and we're all wondering, how do we talk to our children? How do we talk to our family members? How do we talk to our friends about this? That's where we want to bring in a psychologist, an expert on this, and head of pediatric psychology at Connecticut Children's Medical Center, Dr. Melissa Santos. So, Dr. Santos, as you listen to this press conference, and you've been listening to everybody weigh in with their opinions on mental illness, I mean, bottom line is it's hard to get good care. You have stigma, you have stereotyping, you have access issues. On top of that, it's expensive. Look, I'm a mom. I have kids that have had to go to counseling, and it's hard to get in. Insurance doesn't always pay for it. The majority of the time, it doesn't. Not that, I would spend whatever I needed to spend to help my children. But, when you think of people that don't have that kind of access or don't have those funds, it's hard to get help. It's not easy.
It is hard to access services sometimes. And one of the things that we've spent a lot of time talking about in the pandemic is how we could really open up access to care and really ensure that everywhere that a child goes, from school to community organizations to faith-based organizations, that they have people that they can talk to about their emotional health. This isn't going to get better. It's not going to reduce down when COVID ends. We continue to have tragedies like this, and we really need to create a system where kids can get care and families can get care wherever they are.
So for parents, let's just get basic for a moment. For parents that need to have this conversation, our kids are talking about it at school. They see the news. So many kids have devices. They see things pop up through social media. How do you even begin this conversation in a way that will help alleviate just fear and anxiety that our kids may be feeling as they wake up and they're nervous to go to school tomorrow?
Yeah, it's such a great question. And I think to start even having these conversations, you have to remember that parents need to take care of themselves. We oftentimes use the analogy that when you're on a plane, you have to put the oxygen mask on yourself before you help others. And we ask a lot of parents, and we really need to make sure that parents are taking care of themselves, that they are using their support systems to really get through this, and then have those conversations with your kids and asking them, what have you heard? What are people saying? What questions do you have? And really keep information at not only the age for your child, so younger kids are really going to want to know that they're safe, that people are taking care of them. Older kids may want to have more details, but you know your child the best at the level that you know that they can take the information. And I think the key thing for parents too, it's okay to say that you don't know. I think oftentimes we struggle to have these conversations because we always want to have the right answer, but it's okay to say, I don't know. If you're asked a question that you really don't know the response to, it's better to say that than to not even have the conversation with your child.
Right, ignoring it's the worst thing. Is there an age that's too young when you're talking about a mass shooting, weapons, killing, carnage, all these things, right, that we know went down? And is there an age that's too young?
So it's hard because kids are getting exposed to information so very young. And I think the key is that as kids are young, they want to know that they're safe. They want to know that people are looking out for them. And that's perhaps where we can keep the conversation to say, something happened, but we're keeping you safe. I'm here to keep you safe. And I think for young kids, they know that something's happened, emphasize that they're safe. Got it.
So bottom line, figure out some way to talk about it and ensure their safety. Child psychologist and also head of pediatric psychology there at Connecticut Children's Medical Center, Dr. Melissa Santos. Thank you so much. Appreciate just you weighing in and being with us.
Thank you for having me.
Hi, everyone. George Stephanopoulos here. Thanks for checking out the ABC News YouTube channel. If you'd like to get more videos, show highlights, and watch live event coverage, click on the right over here to subscribe to our channel. And don't forget to download the ABC News app for breaking news alerts. Thanks for watching.